Are you tired of that one persistent, maddening itch that just won't go away, no matter how many creams you try? What if I told you that this seemingly harmless annoyance could be a secret, urgent warning from deep inside your body? Many seniors dismiss this as dry skin or just getting older, a potentially devastating mistake. Stick with me, because today we're going to uncover the terrifying truth behind that itch, and I will teach you, once and for all, how to listen to your body's signals to protect your health and longevity. If you're ready to take back control, hit that like button, subscribe to our channel for more life-saving tips, and let me know in the comments where you're watching from so I can give you a shout out next time. My dear friends, let's have a heart-to-heart. We all want to enjoy our golden years with vitality and happiness, right? We focus on healthy aging, striving for a quality of life that allows us to cherish every moment. But sometimes, the biggest threats to our well-being don't announce themselves with a loud bang. They start as a whisper, a tiny, nagging symptom we're all too quick to brush off. I'm talking about an itch. Yes, a simple itch. And I'm here to share some crucial wisdom that could genuinely safeguard your future. I want to introduce you to the work of a brilliant oncologist, Dr. Henry. With an incredible 50 years of experience, he's dedicated his life to the health of seniors just like us. He noticed something astonishing. Over his long career, a significant number of his cancer patients had one thing in common. Months before their diagnosis, they all experienced a peculiar, localized itch that nothing could soothe. This wasn't a coincidence. It was a pattern, a vital clue to achieving longevity that was being tragically overlooked. Dr. Henry's findings are a game changer for our approach to healthy habits. He realized that this specific type of itching is fundamentally different from a typical skin issue. It's an internal signal, a flare sent up by our immune system. When something is wrong deep inside, like with an early-stage cancer, the body releases inflammatory substances that can irritate nerve endings in specific parts of our skin. Understanding this is the first step toward true independence in managing our health. So, let's dive into the first of these critical warning zones Dr. Henry identified, the lower legs. Imagine a constant, deep itch, specifically on the front of your shins. It's not a rash. The skin looks perfectly fine, but the sensation drives you mad, especially late at night. You might think it's poor circulation or dry winter air, but this could be an early whisper from your lymphatic system, a potential sign of lymphoma. This knowledge is power for us seniors. Dr. Henry shared the story of one of his patients, a gentleman who suffered from this exact symptom. For months, the itch on his shins would wake him up like clockwork at 3 a.m. His wife bought him expensive lotions. He tried compression socks, everything you could think of. But the itch only got worse because scratching provided no relief. This is a key difference. A normal itch from dry skin feels better when you scratch it, but this type of itch, an internal one, doesn't. It's a vital clue for your well-being. The science behind it is actually quite fascinating and a testament to how our bodies work. The lymphatic system, a core part of our immunity, becomes more active at night while we rest. If there's an issue like lymphoma, the inflammation it causes spikes during these hours, stimulating the nerves in the legs and creating that intense itch. This isn't about your skin's health. It's about your body's internal defense system calling for help, a crucial aspect of healthy aging. So, here's a simple self-check you can do at home, a healthy habit for an active mind. If you have an itch on your lower legs, commit to using a good moisturizing cream consistently for 1 week. If it's a simple skin issue, you should see a significant improvement. However, if the itch persists or even worsens, and it's most intense at night, it's time to stop guessing. It's time to have a serious conversation with your doctor about your health. The second area Dr. Henry urges us to watch is the middle of the back. Have you ever had a single maddeningly specific spot on your back that you just can't seem to reach? You blame your laundry detergent, your new shirt, or maybe you think you pulled a muscle. But a persistent itch in the middle of your back could be a case of transferred pain from one of our most important organs, the pancreas. This is crucial for maintaining our quality of life. A patient of Dr. Henry's, a lovely 68-year-old woman, was at her wit's end. She had an itch on her back that started every single evening after dinner. She changed her mattress, her soaps, Even got allergy tests. Nothing worked. The problem wasn't external, it was internal. An issue with the pancreas, such as an early-stage tumor, can block bile ducts, causing substances to back up and irritate the nerves that connect to the spine, manifesting as an itch on the back. If you found this insight helpful, please take a moment to hit the like button. It tells me I'm on the right track. Understanding these connections is a huge part of taking control of your well-being. It's about building knowledge and being proactive with your health. The pancreas is directly linked to our digestion and nutrition. So a key clue is if this back itch is accompanied by digestive issues, especially after eating fatty foods. This isn't just a random symptom. It's a detailed report from your body. For those who really want to dive deeper into these kinds of healthy habits, I've put together a guide called Wellness and Aging: Valuable Tips for Seniors. It's full of practical advice just like this. The link is right there in the first pinned comment for you. Here's how you can investigate this at home. Gently press on the itchy spot on your back. If it's related to the pancreas, you might feel a deeper sense of dullness or discomfort, not just a surface-level skin sensation. This simple act of paying attention is a cornerstone of healthy aging and maintaining your independence. Don't just dismiss it as a random ache. Listen carefully, because your body is communicating with you in the only way it knows how. Now, let's talk about our heads, specifically the scalp. An itchy scalp is incredibly common, and we usually blame dandruff or a new shampoo. But Dr. Henry warns that a persistent itch on the scalp, especially behind the ears and on the neck, that doesn't respond to any hair care changes could be an early indicator of leukemia. This is about being vigilant and cultivating an active mind when it comes to our own bodies. Think about it. With leukemia, the body overproduces white blood cells, which releases inflammatory substances into the bloodstream. These can easily irritate the very delicate and numerous nerve endings in our scalp, causing a constant urge to scratch, even when there's no visible rash or flaking. One of Dr. Henry's patients meticulously tracked his symptoms in a diary, noting the itch was always worse when he lay down at night. This nighttime pattern is another recurring theme and a vital clue. When we lie down, blood circulation patterns shift, and these inflammatory agents can pool in the tiny vessels of the scalp, amplifying the itchy sensation. So if you've tried every gentle, hypoallergenic shampoo on the market and the itch persists, especially at night, it's a signal you shouldn't ignore for your long-term health. The self-check for this is subtle. Gently feel your scalp. If the specific itchy spot feels slightly warmer to the touch than the surrounding areas, it could be due to that localized microinflammation. Also, pay attention to other signs. Are you feeling more tired than usual? Do small cuts seem to take forever to heal, or are you bruising easily? These, combined with the scalp itch, form a bigger picture that warrants a blood test and a doctor's visit for your well-being. The fourth surprising area is the chest. For women, an itch around the bra line is often blamed on an ill-fitting undergarment. But Dr. Henry cautions that a persistent itch on or under the breast, especially if the skin starts to look a bit like an orange peel, thicker with little dimples, can be a sign of inflammatory breast cancer. This type often doesn't present with a distinct lump, making the itch a primary clue for seniors. And gentlemen, this is important for your health too. While much rarer, men can also get breast cancer, and an unexplained itch around the nipple area should never be ignored. For both men and women, the key is to look for asymmetry. Does the skin on one side look or feel different? Is there any redness or swelling, even slight? This isn't about vanity, it's about life-saving observation. One of Dr. Henry's patients, a very detail-oriented woman, was convinced her bra was the problem. She tried every material imaginable: cotton, silk, even bamboo, but the itch on just her right breast continued. That specificity, the fact that it was only on one side, was the crucial detail. It pointed away from a general allergy and toward a localized problem, a vital signal for maintaining her quality of life and independence. The self-check here is visual. Stand in front of a mirror and take a good, honest look. Compare both sides. Look for any subtle changes in texture, color, or size. The itch often starts around the nipple or areola. If you see any of these changes accompanying a persistent itch, please schedule a checkup. Early detection dramatically improves the prognosis and is a cornerstone of healthy aging. If you know someone who needs to hear this, please share this with them. Next, we need to address a more delicate area, the anal or genital region. I know it can be embarrassing to talk about, but your health and happiness are far too important to let embarrassment stand in the way. A persistent itch in these areas is often assumed to be hemorrhoids or a simple infection. However, it can be a sign of anal or vulvar cancer, and recognizing the difference is key to longevity. Dr. Henry tells the story of a man who had dealt with hemorrhoids for 30 years. When a new itch started, he just assumed it was another flare-up, but he told the doctor, "This time it feels different." Instead of just being sore when he sat down, it was a constant, sharp itch, almost like tiny needles, even when he was still. That's a critical distinction. It's a change in the pattern, a new signal from the body. The problem is that tumors in this region can compress the surrounding tissues and nerves, causing this unique, persistent tingling or itching sensation. It's different from the general discomfort of inflammation. Normal treatments like creams or sitz baths might offer no relief at all, or the problem might worsen over time. This is your body telling you that the usual remedy isn't working because the root cause is something different and more serious. So the self-check is about careful observation of the sensation and pattern. Is the itch in one very specific spot? Does it feel sharp and deep rather than like a surface irritation? Does it get worse at night? Also, pay attention to any other accompanying symptoms, like changes in bowel movements or urination. Please, for the sake of your health and independence, do not delay seeking medical advice out of shyness. A quick checkup can bring peace of mind or lead to life-saving early treatment. The final warning zone Dr. Henry highlights is our hands and feet. This one is particularly sneaky because it's so easily mistaken for other issues. If you experience an itch that is only on the palms of your hands and the soles of your feet, it could be a sign of various internal cancers. The toxins produced by tumors can travel through the bloodstream and affect the peripheral nerves in our extremities. A patient of his, a 70-year-old man, was convinced he had housewife's eczema from washing dishes. He tried wearing gloves, using gentle soaps, and moisturizing constantly. But the itch was only on his palms, not the back of his hands, and the lines on his palms seemed deeper and had a slightly yellowish tint. The skin on the rest of his body was perfectly fine. This high degree of specificity is the clue. This kind of itch is a systemic signal. It's not about dry skin or an allergic reaction on the surface. It's about something happening deep within your body's major systems. It's often worse at night and can affect both hands and feet symmetrically. Soaking them in cool water might provide a fleeting moment of relief, but it won't solve the underlying problem, which is essential for your long-term well-being. The self-check here involves looking closely at your palms and soles. Do you notice a yellowish hue? Do the natural creases and lines look deeper or more pronounced than usual? If you have this specific localized itching on your palms and soles that lasts for more than a few weeks, it's a powerful reason to get a comprehensive health checkup. It's a healthy habit that could protect your quality of life. All right, now that we've covered the 6 warning zones, let's put this all together into a simple 5-step self-diagnosis plan. This is your personal toolkit for an active mind and body, empowering you to be the guardian of your own health. Remembering these 5 steps can help you distinguish between a simple annoyance and a serious warning sign, contributing greatly to your longevity. First is the 3-week test. It's simple but effective. Any normal skin issue or minor allergy should start to improve within a week or 2 with basic care. If an itch in a specific spot persists for more than 3 solid weeks, you need to upgrade its status from annoyance to potential health signal. Mark it on your calendar. This simple act creates accountability and supports your journey toward healthy aging. Next, we have the lotion response test. As we discussed, if an itch is from a simple external cause like dry skin, a good moisturizer or an anti-itch cream should provide significant relief when used consistently for a week. But if you're applying cream 2 or 3 times a day and the itch doesn't budge, or even gets worse, that's a huge red flag. It strongly suggests the problem isn't on your skin, but under it. Has this information been an eye-opener? Let me know in the comments below. I read every single one. Third, you must check for secondary symptoms. An itch related to a serious internal issue rarely travels alone. It often brings friends. Are you also experiencing unexplained weight loss, a persistent low-grade fever, or a level of fatigue that feels bone deep and isn't solved by a good night's sleep? These accompanying symptoms are your body's way of shouting for attention, and they add urgency to getting a checkup for your well-being. The fourth step is to analyze the itch pattern. This requires you to become a bit of a detective for your own body, which is a fantastic habit for an active mind. Keep a small notebook. When does it itch? Is it consistently worse at night? Is it always, without fail, in the exact same spot? A random, migrating itch is less concerning than one that relentlessly targets the same specific point day after day. And fifth, review your family history. We can't change our genes, but knowing them gives us an incredible advantage in preserving our health and independence. If your parents or siblings had a certain type of cancer, your risk is inherently higher. This doesn't mean you should live in fear, but it does mean you should listen to your body's whispers with extra care and be more diligent with regular checkups. So, let's quickly recap Dr. Henry's 6 danger zones. An itch on the lower legs could signal lymphoma. A spot on the middle back could be your pancreas. An itchy scalp might point to leukemia. The chest area could indicate inflammatory breast cancer. The anal or genital region could be a sign of related cancers. And finally, just the palms and soles could signal other internal issues. Remember the 5 steps: the 3-week test, the lotion response test, checking for other symptoms, analyzing the pattern, and knowing your family history. These aren't meant to scare you. They are meant to empower you. They are tools for your longevity, your happiness, and your independence. They transform you from a passive passenger into the active, alert captain of your own health journey. Most cancers, when discovered early, are highly treatable. The tragedy that Dr. Henry witnessed over his 50-year career wasn't just the disease itself, but the countless times it could have been caught sooner if only these small signals hadn't been dismissed as just getting old. Your body is your oldest and most faithful friend. It's time we start listening to it with the respect it deserves. So, here is my challenge to you tonight. Before you go to sleep, do a quick mental scan of your body. Is there any spot that's been bothering you? How long has it been there? When does it get worse? Don't just dismiss it. Acknowledge it. Write it down. This simple act of mindfulness is one of the most powerful, healthy habits you can cultivate for your quality of life. And if any of the signs we've discussed today resonate with you, please make that doctor's appointment. Go in armed with specific information. This spot on my back has been itching for a month, it gets worse at night, and creams don't help. This level of detail helps your doctor help you. Your health is your greatest treasure. Let's protect it together. What's one thing you'll start paying more attention to after hearing this? I'd love to read your thoughts in the comments. And if you haven't already, please subscribe and ring that notification bell so you don't miss our next video, where we'll discuss the hidden warnings behind common joint pain.